or naloxone, which can reverse an opioid overdose. So if you see somebody who overdoses, you can save their life.
How do you do that?
So this is in here are 2 different doses, 2 different IM syringes, and the full instructions of everything that I'm about to tell you. So this here is the statewide prescription. So it is 100% completely legal for you to be in possession of this all the time, at any given time, anywhere that you go within the state of Arizona. No one can take this away from you. Okay? And so inside you've got the 2 different doses, and they are light sensitive, so that's why we keep them in the bag here. And so you want to keep them in the bag, but you can have them outside with you, and that's not a problem. Okay? And so if you see someone that you think is overdosing, they'll generally appear unconscious with their lips, or the tips of their fingers will start to turn gray or blue. They'll appear unresponsive, and you can take your knuckles and you can do a sternum rub. And if they don't respond, you know that they're in need of help. If there's another person there, you can tell them to call 911 and just say that your friend isn't breathing. You don't have to mention drugs. You don't have to mention naloxone. There's no need for that. You just need paramedics and not police officers. And so then at that point, you can take out a vial in here, and it looks like this. And you just pop the orange cap off. You turn it upside down. Take one of these needles, and you can pull the plunger back and then insert it in and push that air into the vial. It'll literally fill the needle all by itself. Okay? And so then you take that and you inject it into the person's upper arm or their upper thigh. You don't have to take their clothes off. You can go right through the clothes, just inject the whole thing at a 90-degree angle, and then you want to start rescue breaths. So the heart is still beating, they're just not breathing. And so if you don't get a response from them within about a minute, you can draw up the second dose into the other syringe, and you can inject that into them on the other side of the body. And then at that point, you should start to get some kind of at least a stir from them. And if not, hopefully the paramedics are there to administer more naloxone if you need it. And you can roll them onto their side like this into a recovery position, so that way if they vomit, they won't choke on it. Because it is going to make them sick if they did take opioids, because it's pulling all those opioids out of their system. And so they're not going to be very happy, but they're going to be alive. And this medication only lasts about 90 minutes. So you don't want to let them use anymore, and you want somebody to stay with them for up to 3 hours to make sure that they don't overdose again once this medication wears off from them. But they will still be alive, and they can, go on from there. Any questions? No? Okay. Would you like to take this with you?
Yeah.
Yeah, absolutely. Would you like longs or shorts?
How much?
Do you usually inject drugs? No? Okay. So these are kits that are ready for people who inject drugs to have safe use supplies, sterile supplies. Did you need supplies like that?
Yes.
Okay. Do you want, it's personal preference on what you want.